You want to start the recording? Hello, everyone. My name is Brett Steele. I am the Senior Director of Preventing Targeted Violence at the McCain Institute. Thank you for joining us for our 7th workshop for the Emerging Prevention Practitioners Network. For this workshop, we will be discussing the threat of internationally inspired violent extremism and promising practices to prevent it. As many of you know, the Prevention Practitioners Network will be a national network of interdisciplinary professionals dedicated to preventing targeted violence and terrorism and their impacts within the United States. We're currently seeking your guidance on how we will shape this emerging network. So we will ask you to fill out a brief survey. Addie will provide the link in the chat box. If you filled out this survey before, you don't need to fill it out again, but if you haven't, please, we're trying to get as much input as possible. We're also asking people to volunteer for various committees that will be meeting for the first time this fall. For more information on how to join this professional network, we'll be communicating with you by email, or you can reach out to Addie Fairley, who will put her email in the chat box. For today's workshop, we have a fantastic panel of subject matter experts prepared to discuss both the threat landscape of internationally inspired terrorism and promising practices for prevention. Each panelist will discuss this topic for about 7 to 10 minutes before we open the floor to the audience for discussion. When we do open the floor to the audience for discussion, we encourage you to turn your cameras on. You can put questions in the chat. You can also, and for the longer questions, I frequently invite you to read them aloud to the group. We're trying to build a network here, so we want as much engagement from you as possible. At the end of today's discussion, we'll ask you to participate in a survey. I mentioned that already. However, in order to effectively assess the lessons learned in this workshop, we're going to launch an anonymous pre-assessment poll right now. Ultimately, these workshops are put on to benefit you. So we want to know how we can best serve you. Please feel free to contact us with any suggestions on how we can improve our future workshops. Lastly, I want to thank our partners who have helped us make this event possible. Everyone on our steering committee, many of you are in the audience or in fact speakers today, the Institute for Strategic Dialogue, Anti-Defamation League, and of course, thank our funder, the DHS Center for Prevention Programs and Partnerships. So I will give the pre-poll a moment here. Please go ahead and answer those questions. One thing I should mention while you're completing the poll, we had originally planned on doing an in-person workshop this fall. Due to the unpredictability of the Delta variant and our desire to keep everyone in this network safe and feeling safe in engaging with us, we've decided to shift that in-person workshop this fall to online. We will probably have a much more interactive approach to that. We're thinking about a lot of different ways to engage everyone across the network in more of a conversation. And so stay tuned for what that fall workshop will look like. And then we are still planning, hopefully, all COVID permitting, to have 2 in-person workshops next year, and we would have even greater numbers of travel scholarships for those workshops, given the shift to virtual this fall. All right. thank you for participating in these polls. It's very helpful. We are being evaluated by the Research Triangle Institute, and it's helpful for us as well as for that evaluation to get audience feedback, both before and after workshops. Okay, without further ado, I am going to go ahead and introduce our speakers. Discussing threat today, we have Milo Comerford from the Institute for Strategic Dialogue. Milo, in addition to his role at the Institute for Strategic Dialogue, serves on our steering committee, and we're very grateful for his participation here today. It's a big topic to cover, and Milo, take it away.
Thank you very much, Brett. And with that tee up, I'm going to instantly limit what I'll be focusing on today, and say that the broad issue of international terrorism and violent extremism is obviously a kind of incredibly broad and wide-ranging topic, and the read ahead materials that we've circulated ahead of this sort of speak to the broader dimensions of the challenge and how that's evolving. And obviously in the context of the 9/11 commemorations and the 20-year commemorations around this last weekend, there's undoubtedly a lot of sort of conversation and discussion around the current threat landscape from international terrorism, how it relates to other forms of violent extremism and targeted violence. But today I'm going to be focusing on the way that we've seen threats change in the online sphere. So really focusing on the sort of digital dimensions of this challenge, and looking to sort of take a bit of a deep dive really about the ways that international terrorist and extremist groups are manipulating digital platforms and online platforms. And hopefully we will be hearing lots of interesting emerging practices and interesting examples from practitioners on what this means for prevention and what this means for intervention. So I'm going to share some slides and just run you through some of these sort of top line findings from ISD's own research. So as mentioned, really the kind of the organizing principle of this is thinking about how the propaganda machinery and the sort of broader online communications of international terrorist groups, and I'll be focusing here specifically on Salafi jihadi inspired groups that are inspired by a violent ideology and a belief in a violent interpretation of jihad, and implementing that in an effort to sort of build up a idealized, what they perceive to be an idealized Islamic society, as characterized by international terrorist groups like Al-Qaeda and ISIS most prominently. But there is a broader sort of array of international violent extremist mobilization beyond this, but this really does constitute sort of the most significant and notable challenge, both online and offline. Really the thing I want to emphasize is that we're seeing a sort of state of transition emerging in this international field. Whilst many have sort of heralded the defeat territorially of ISIS in Iraq and Syria as sort of precipitating the demise of this movement, of course, that is a premature assertion, and we only have to see events in Kabul recently and to look at the fast changing nature of the terrorist threats to realize that really this is a challenge that will continue to mold, continue to morph, and continue to sort of have a dynamic relationship with other forms of terrorism and extremism, including domestic varieties, which I'll go on to speak about a bit later. In particular, one of the big trends we've seen online is really understanding the fact that whilst companies and governments have got better at removing explicit material associated with foreign terrorist organizations and designated groups, there is nonetheless a sort of broader challenge that we're seeing online from what we describe as post-organizational content, stuff that might not be sort of formally labeled as ISIS material or from a formal media house or wing of a designated group, but rather part of a sort of broader violent milieu of online content, which provides major challenges to practitioners and to policymakers alike. So really to speak to this broad range of mobilization that we've seen, ISD's work has mapped the sort of broader range of Islamist extremist activity across a range of platforms for over a decade. Really, we're looking at, as mentioned, official groups like ISIS and Al-Qaeda, as well as support groups of these movements, which are proliferating on both mainstream and alternative platforms. We have Islamist-inspired groups that are Iran-backed as well, who have a concrete online footprint. And we also see this broader sort of meme factory emerging of individuals who certainly don't affiliate with a specific group, but nonetheless are producing ideological material supportive of these international violent extremist ideologies. This is obviously taking place in a broad range of language contexts, and our work has shone particular spotlights on Arabic, Swahili, Bangla content, which really does permeate borders and is able to sort of travel quite freely and more freely than English language content. And also across platforms. A lot of our work has looked at how narratives have developed and morphed across mainstream platforms, Twitter and Facebook, as well as alt tech platforms like Telegram and platforms like SoundCloud, which obviously have a slightly different role in the ecosystem, but still very relevant to mobilization.
Some video footage of the uprisings collapse contributed to
I think we've got someone unmuted.
Area. Beginning in 2003, Ambassador Galbraith was an informal advisor.
Ali, I don't know if you can mute the. Thanks very much. That's great. Just wanted to point to the acceleration of international extremist narratives during COVID-19 in particular. As many of you know, we saw a lot of mobilization by extremist actors across the political spectrum who were essentially using the sort of uncertainty of this period to spread divisive and sort of polarizing content and posing supremacist and violent solutions to these challenges. Across the groups that we were monitoring the online presence of, we saw key narratives emerge that COVID as a virus was sort of an ultimate opportunity for political and economic collapse that could be seized upon by terrorist organizations. We saw COVID presented as a sort of as God's work, or a so-called soldier of Allah in the context of an ISIS video, and we saw highly conspiratorial accounts of the origins of the virus, it being framed as a Zionist biological terror attack, a range of different related narratives that really sought to use the chaos and uncertainty of the period and really sort of drive a campaign of messaging and recruitment. Examples of this on Twitter, we saw a network of accounts that were highly active in using COVID-19 related hashtags to spread ISIS propaganda in a range of different contexts, and garnering lots of views of ISIS propaganda, and using a number of tactics which I'll go on to discuss to circumvent the moderation of online platforms, and linking out to a range of different websites which host pro-ISIS propaganda. And on Facebook, we saw, again, sort of coordinated activity emerging, where we see networks who are demonstrating quite extreme resilience on platforms that are hostile to their activity, but using loopholes and using cross-platform activity to survive and flourish in a way that is, of course, kind of concerning in the context of the work that we're doing. And able to use a number of different tactics, including masking their content, coordinating raids on the site, and hijacking hashtags to achieve these ends. In terms of the broader trends of internationally inspired terrorist mobilization, we've seen a number of different sort of platforms emerging as standalone websites, as we see more and more hostile environments across mainstream social media platforms whose terms of service and technologies for taking down this content continues to sort of proliferate. We're actually seeing an increasing trend of sort of extremism-owned websites and sort of standalone sites that are housing support groups for terrorism, who are providing the official sort of media for groups, and hosting and sharing propaganda. These are very closely networked with digital archives that store this kind of content online. We have been mapping at ISD an enormous, what we call a sort of cache of extremist content associated with ISIS, which are maintained by supporters groups, and then social media networks being used to proliferate this and to really provide a kind of ecosystem for following. And finally, we're seeing trends towards the increasing use of encrypted messaging apps, both Telegram, which has taken action previously on the group, but unfortunately we've seen the resurgence of ISIS in particular on Telegram as a platform, but also a range of other similar encrypted messenger apps like Rocket Chat, for example, which are being increasingly used for extremist communications. We're also seeing a range, a sort of toolbox, if you like, of evasion tactics being used to sort of circumvent attempts to prevent the usage of digital platforms by international terrorist organizations, a number of which we've sort of mapped with our research, but essentially looking at more and more sort of innovations in this area to circumvent, including the cloaking of explicit terrorist content, the deliberate use of sort of ambiguous or sort of gray area content, using tactics, so storing up accounts and sort of simulating network dynamics to try and artificially amplify terrorist and violent extremist content online, as well as organizing raids on specific platforms. And one notable one that we saw in the US context was an ISIS raid on the pro-Donald Trump website Getter, which was where we saw a large-scale, what ISIS supporters called an occupation of the site, and the platform itself was by design sort of quite low moderation and very sort of free speech focused, and so the group was able to proliferate relatively easily on this platform and sort of to some extent capture elements of it as well. And an investigation that ISD did with Politico found the considerable proliferation of these accounts in a way that was quite notable for a platform that was perhaps not associated with this kind of extremist material, but actually was hosting much more white supremacist and REMV content. And so notably, we saw a sort of interesting coming together of different extremist communities in this context. Which sort of leads me on to this final point in this quite quick tour of developments in the online space around international terrorism, which is this increasingly hybridized ideological threat. We're seeing fewer and fewer sort of hard and fast distinctions existing between different communities online. We're seeing the borrowing by international extremists and people inspired by Salafi jihadi ideologies of some of the tropes, some of the visual formats, some of the memes of REMVE and white supremacist actors. This is an example of a meme that is circulated across both pro-Taliban and pro-white supremacist movements online, and really sort of pointing to a sort of bizarre alliance that seems to be emerging ideologically, where both these different forms of extremism, very different, of course, in their outlook and their sort of ultimate aims and goals, but nonetheless agreeing in the sort of fundamental sort of moral failings of the Western world, and believing essentially that their supremacist vision is the way to return things back to a sort of traditional and pure society. And this is something which should be, kept an eye on, in particular by practitioners and by policymakers, which is really understanding the sort of odd ways that different extremist communities online are intersecting and sort of essentially influencing each other online in terms of those sort of the cross-pollination dynamics of different forms of extremism. So I'm going to leave it there. As mentioned, this is really just a deep dive about the current state of some of the online challenges that we're seeing, but really look forward to hearing from people who are coming with a more practitioner-focused perspective to think about the implications of where the threat we currently face from international violent extremism.
So Milo, we have a question in the chat from Adnan. Adnan, do you want to go ahead and ask that directly?
Sure. Very. Okay. Yeah, Milo, in the beginning, you just very sort of pushed in that jihad. You use the word jihad and equate it to terrorism. Can you please clarify what you meant by that?
Of course, yeah. There's always an interesting definitional debate, and we work very closely with a lot of Islamic scholars with our work, and really what we're not doing here at all is equating the concept of jihad, the sort of spiritual concept of struggle within Islam, with terrorism by any means. There's a sort of technical terminology around the notion of Salafi jihadism, which is a kind of subset of the broader Salafi ecosystem and sort of puritanical and kind of I suppose you'd say reformist strains within Islam that distorts the notion of jihad in a very specific way. It's a sort of technical term that is used, but I understand there is a lot of sensitivity around using it, so I've tried to use it in a very specific way. But of course, many of the most powerful counter responses and counter narratives around pushing back against this kind of international form of extremism is about reclaiming that notion of jihad by Muslim scholars, by Muslim civil society, to sort of prevent it being abused by extremists, essentially. But yes, you're it's an important distinction to make, absolutely.
Are there other questions for Milo? All right, Milo, we're going to invite you to engage in the broader Q&A at the end of this workshop, but we'll go ahead and move on to our practitioners. This is a topic that several organizations have worked to build capacity to address here in the United States, and yet it's changed over time in some ways Milo just referenced. So our speakers have interacted and provided prevention and intervention programming at different stages in this evolution. We wanted to share that evolution with you. And we've invited our speakers to be very honest about how things have changed over time as well. Our first speaker on the practitioner panel is Humaira Khan. Humaira is the president of Muflihun and was really one of the first in this country to begin with direct engagement with individuals who are considering traveling overseas to join foreign terrorist movements. And spend a lot of time grappling with how to do that responsibly. So Humaira, with that introduction, I will turn it over to you.
Thank you, Brett. Hi, everyone. Pleasure to see everyone. Brett, keep me on time. When I start to talk, I will, I don't like stopping then. Brett has asked me to talk about our program for interventions. So I'm going to give you a little bit of history, right? Because we were we started early, and then we saw a lot of issues in it. And again, we are promised an honest conversation. So let's start with that. So I'll give you a little bit of history. So we started in 2010, the organization. By 2011, we were getting referrals from families who were concerned about their family members who were either going to join Al-Qaeda, Shabab, ISIS didn't exist at that time. And so we were seeing cases, and then we were starting to do them sort of in an informal way, and we were working through clergy who were also licensed social workers. And so that was how we were doing it. And then around 2015 is actually when we started to set up a formal program. So our first thing we had to do was actually we got private funding. So one of the things is that beginning at the, because we're dealing with Al-Qaeda and not ISIS, but Al-Qaeda, Shabab, etc. in that space, we knew that a lot of the people calling in would actually be, or the ones who were, the referrals we were getting was coming from mostly the Muslim community. And given the relationship between the Muslim community and law enforcement and the lack of trust and the fact that there's been so much profiling for years and surveillance and all of these other concerns, we knew that the funding mattered. So actually for this program, we had to secure private funding to ensure that we could have the independence of it for our, for the community itself. So that took a while because again, private funding to set it up. But again, we actually did get, we got it to launch it. And then we actually had to structure it. And in the structuring actually, so what we were setting up was a helpline, right? To stay so that we could actually expand how we were providing intervention or counseling services and to be able to link people to support systems remotely or actually in the area itself. So what we had to, to build out our standard operating procedures before we could set this up, we actually had to work with lawyers. So we work with a lot of criminal defense lawyers, because in this space, let's remember, there is this whole material support to terrorism clause. And there's a lot of concern as to what you can or cannot say, and where does reporting requirements come into place when you're talking about someone who is thinking about joining Al-Qaeda When in 2012 or so, when ISIS started coming around, also what would that be? Because by 2015, ISIS was in full swing. And what does that mean? And even the space of talking to someone to pull them off or to get them to stop towards violence, there was always these concerns about it's a gray area, and where does the gray become an area which will be a problem for us? And I mean, we got advice, for example, from criminal defense lawyers. One of them was, for example, for a helpline, you want that your initial intake person to not be a lawyer, and you want them to not be a psychologist, because that reduces, that way you can have a naive intake and then actually be able to refer them to the right resources. And then once you have enough information for actually having to trigger reporting requirements. So all sorts of like things you never think about. We talked to psychologists. So we ended up with lawyers who were willing to actually work with us. We found psychologists, and a lot of them, or actually the majority were those who actually focus on trauma. We talked to people who had spent their careers in juvenile justice. So people who had worked with OJJDP for a long time. We talked to people, and that was to understand, okay, what are the alternatives which might be available. We were talking to gang violence prevention groups, and that was to really understand how to engage, especially with family members, and how do you create that safe environment for helping. And then we will also talk to organizations who prevent human trafficking. And that was to really understand what would be, especially for helpline, what would you need in terms of confidentiality, and how do you manage that space to ensure that we could, one, maintain the confidence of people who were calling in, but at the same time ensure that we were able to get enough information and not put anyone at risk. So anyway, long story short, we actually ended up with like standard operating procedures. And again, structuring or keeping all of these things into account. The process from there to even actually get the helpline off the ground was crazy. I mean, that's the only way to describe it. So I'll start with, case management software companies, because those exist, right? Who have been working with for years, and they provide case management software. So one of the ones was really well equipped to deal with this. For example, they refused to sell to us. And they said that what we are doing is too high risk. Their lawyers got involved, and they literally refused to even sell us the software because they said that if our records get subpoenaed by the FBI, we do not want to turn our server over, which has got all our other client information also. So they said we can set up a completely new server for you on the cloud, but the price tag was actually an order of magnitude higher. When they finally, the lawyers, and even then they sort of hedged on that, if they can, will not. Insurance providers, just for insurance for our staff, they refused to give that. So we had, and that the underwriters got involved, saying we will not provide insurance for any of the staff. In fact, we don't want to touch your company, organization with a 10-foot pole. We had, when we tried to get office space, we had organizations completely refuse to even just rent us an office because it's like, what are you doing? There's no way. So that was the space where we started off. So we ended up launching this in 2016 with a lot of, again, it was a very painful process. And here's the thing. The first couple of calls we got into the system were actually all around the extreme right wing. They weren't even about Al-Qaeda, ISIS, forget all that. It was about domestic concerns. But the reality is we actually ended up post-elections. Actually, we ran into the situation where the FBI told us, and I quote, "You're on your own." And we had a U.S. attorney, outgoing U.S. attorney, advise us to actually stop our program, suspend it. And he said, if you do it, he said, I'm willing. His words were, when you get into trouble, I'll be willing to represent you pro bono to get you out of jail. But my advice is that you should end the program. And there we were in a situation where we did not know how we would be able to protect some of these counselors. just literally the counselors themselves, because the world had shifted. So we actually did end up suspending that program. And I think one of the things to note is that when you think about, I think about like the transition and how the space has evolved, right? It used to be the world of CVE, then it became TVTP. Now we're in, I don't know what it is now in terms of language, but that transition from CVE to TVTP, right? And that's a shift in the office, will shift in administration perspectives, etc. But one of the biggest shifts was that the space for community-led initiatives, which were not government funded and which were not directly working with law enforcement, that space shrunk considerably, right? So everything, the assumption was that everything going forward, because for us, our referrals were coming from community, family, friends, right? We were not taking referrals from the FBI. Now, there were several cases, I would say, actually, when the family members themselves asked, look, we need to talk to the FBI. And we would help sort of make sure that they were actually connected to law enforcement. And we've also, because most families, when they know something there's a problem, they want to get help. Because at that point in time, they just want to make sure their loved one doesn't do anything, doesn't hurt anyone, or end up like hurting themselves. So at that point in time, there's this huge space where they're like, look, any way that we can get help, we want to get help. Right? And so there was a lot of cases where they were like, yes, we actually want to go to the FBI, we want to talk to them, help us, because we don't know who to call, how to arrange it. We also want to make sure that just raising the issue should not end up being with the person being arrested right away. Right? So again, so we had a mixed bag of cases. And I told Brett before, when she'd asked me to speak, that, right, our program is suspended. And she said, no, yes, but still talk about it. And I think the other thing is that even after we formally suspended the program, we are still getting calls. We get a couple of calls every year for families who are looking for help. Literally, I got one 2 weeks ago from a family member, from the family of someone who has traveled just this July, who's gone into Syria, and they're looking for support. And so what it did transition into is that we are now dealing a lot more with families who are looking for support, rather than because it's the person has already traveled, they've already gone to a conflict zone. And so the family is looking for support and to figure out, one, how do you protect the rest of the family members? And how do you get like mental health resources, or how do you just get help so that the family doesn't fall apart? I'm going to end now, and thank you for listening to me.
All right, thank you, Humera. Thank you for your candor. I wanted to make sure this workshop was not sugar-coated. This is a delicate area. One of our future workshops that Richard Aborn and I have been working on is a workshop on criminal liability. These are concerns that Humera brought to me probably 8 years ago now, and that we want to provide as much guidance as we can possibly provide. We can't provide legal advice, but at least give you a sense of questions you should be talking about with your counsel if you're taking these cases and you have concerns. Our next speaker is Heidi Ellis. Heidi was also, she's at Boston Children's Hospital. She was also on the front lines very early on in designing what programs could look like, and has gone through several iterations now of what programs could look like. So I asked Heidi to speak to the original program she designed in this space, but also to that evolution of programming over time. Heidi, over to you.
All right, thank you very much, Brett, for the opportunity to be here, and thanks to everyone who's putting up with another Zoom hour so they can hear it. I'm going to do a little share screen here. Okay, so I will talk with you about our program Community Connect, a multidisciplinary model for reducing violence risk among youth. I want to start by saying you might have noticed that the term, let's move my picture, that the term internationally inspired terrorism didn't appear on my title slide, and with good reason. I want to talk today about a program that we developed that very specifically was not focused on internationally inspired extremism. So, why am I on this panel? You may be wondering. I will briefly explain why we stood up our program the way we did, and also its relevance for this topic. Some 20 years ago, I started doing research in partnership with the Somali refugee community in the United States. And our research was focused on understanding the connections between trauma, discrimination, and mental health among Somali youth. Obviously, a 20-year community-based participatory research project does not fit well within a 7-minute talk. So I'm going to cut to the chase and just tell you the 4 lessons that were most evident in our data and in the process of our research. So first, we learned early on that if you don't engage the community that you are trying to help, you don't accomplish anything. Engagement is the first step of any meaningful program. And this means developing genuine partnerships with mutual respect and shared power. Second, we very quickly saw in our data the toxic effect that stigma and discrimination had on the health and well-being of Somali youth. It was abundantly evident that we needed to address stigma and at all costs not contribute to false stereotyping and discrimination of Somali youth. Third, we also quickly realized that outcomes in a siloed, fragmented way, looking at outcomes that way, both missed what mattered to the community and also created a shallow understanding of the complexity of human experience. So we realized that we needed to address multiple outcomes and recognize strengths in our programming. And finally, when we did look at a range of outcomes in our research, from gang involvement to mental health to openness to violent extremism to civic engagement, we consistently saw that strong social connection, and in particular a sense of attachment to the United States or Canada for those who lived there, was related to better outcomes. So it was right about there, as we were distilling these 4 lessons, that CVE started to gain traction in the United States, and controversies around what CVE was and wasn't abounded. Regardless of the intent behind the programs, the way they were rolled out led to significant critiques. And these are some of the critiques that I thought were most salient. CVE programs largely failed to achieve any engagement from Muslim communities. CVE was seen as targeting and therefore stigmatizing Muslim communities. CVE programs were seen as focusing on a single outcome of very low importance to communities compared to other problems such as gang violence. And CVE undermined a sense of connection and trust between Muslim Americans and the government. So you can see the problem here. CVE flew in the face of the 4 lessons that we learned from our decades of work with the Somali community. At this stage, my colleague Saida Abdi and I were deeply immersed in research around this issue and felt like we had a pretty good understanding of what should and shouldn't happen in the effort to prevent violent extremism. We felt strongly that prevention should involve a community-led, multidisciplinary team that focused on engagement, that did not target any single group or ideology, that addressed multiple needs of a community, and that focused on connection to society and to services. The problem was we didn't know if this was possible. So there was this one afternoon, we were sitting in my office talking about what the field really should be doing. And we had this thought, kind of one of those simultaneous thoughts where you look at each other and know exactly what the other person is thinking. And we said, okay, we need to see if this is even possible. We need to do what we've been telling other people they should do. So we decided to reach out to our respective networks in Boston and invite a bunch of people to a meeting to talk about what we were calling unmet needs of youth in our communities. Saida invited religious leaders and community leaders. I invited folks from law enforcement, mental health, and education. Everyone showed up in this little room. This was in the pre-COVID days where you could jam like 20 people into a tiny, hot, sweaty space. And we opened this question about what are the unmet needs for the kids in our community? And people talked about what they saw from their perspective. And the distrust in the room was palpable. So we had one of our Somali community leaders who was busy texting Saida saying, why is she here? And referring to a woman who was from the Boston Regional Intelligence Center. And you could see this was not a group that was used to coming together or comfortable coming together. But we held the meeting. We agreed there were a lot of unmet needs, and we agreed that we would email everyone about another meeting to keep talking. But what happened next, I could not have scripted. About 2 days later, someone from law enforcement from that group emailed the group and said they were having an issue with someone, and they thought there might be a cultural misunderstanding. Could they get some advice? So a bunch of folks from that meeting, including the community leader who was so skeptical, got on the call, and after the consultation, law enforcement decided to hospitalize the individual rather than arrest them. A few days later, there was another email to the group, this time from the leader of a local mosque who had been there, and he reached out to say that they were receiving some concerning messages in their voicemail box. Law enforcement partners were able to step in, identify the source of the calls, and ensure the safety of the mosque. And then, finally, a few days later, that same community leader who had been so hesitant about the partnership with law enforcement emailed the group and said she was worried about a kid who was getting in trouble with the law, and could the group help? So, without actually meaning to be an operating team, we became one. I think about that period as absolutely critical to why our team was able to operate. We built trust through action. The team was built through responding to real needs and a range of needs. Over the next period of time, we formalized our team with all the bells and whistles like MOUs and BAAs, and we were a multidisciplinary team that included law enforcement. We accepted referrals from federal law enforcement, but they did not sit around the table and did not have access to what we talked about. The basic idea is we would take a referral and do an initial review to determine whether it fit with our program. Then we would send in a trusted liaison and a mental health provider as a team to meet with the family and conduct a more thorough psychosocial assessment. We would then take that information back to our multidisciplinary team and integrate a range of perspectives, including thinking about the family goals, and develop a services plan that could build on the strengths of the community and the providers in it. And then our team maintained some ongoing contact so that we could be in touch both with the family and also with the providers to make sure that the package was working. We organized ourselves around 3 main goals. We wanted to engage youth in needed services. And a key part of that was partnering with trusted liaisons who could really connect with families. We wanted to increase provider capacity so that when we made referrals, we were working with those providers to better understand cultural or ideological backgrounds of the families they were working with. And we wanted to support ongoing connection, both in terms of connections with the family, but also connections between this multidisciplinary team and all the stakeholders who are coming from their different perspectives and disciplines, and building those relationships as a team. So you probably have noticed, I was talking in the past tense. What happened? We ran the Community Connect as a team, as a pilot program for a couple of years using foundation funding. And I think it was really successful for what we wanted it to be. It also was challenging. That level of partnership was expensive to sustain, especially when the volume of youth that we were able to serve was low. Reaching a geographically larger area would increase volume, but also make it impossible to sustain deep local area community involvement. Federal funding, which was a logical next step, was not something our community partners felt comfortable taking. So when we reached the point when we needed to transition from small foundation funding to federal funding, we had to shift our model. So we are currently implementing a Rev 2 or 3 or some number of the program that is DHS funded, regionally based across a 4-state area, and focused more specifically on terrorism and targeted violence. And that's all comers to terrorism and targeted violence. We maintained that this is not about any particular group or ideology. We are still getting our programmatic feet under us, but I can tell you that in contrast to a few years ago, we have not received any referrals for youth at risk for internationally inspired terrorism. So I have some theories about why this is. They're just theories at this point, but it does remain to be seen whether this new program will be able to serve and have relevance for that issue or not. So let me wrap up there and end by saying this is all still a work in progress, but thank you very much for your time.
Heidi, thank you so much for that. I know you were focused on your talk, so you may not have seen the conversation in the chat, but there is a lot of back and forth in the chat. Some of the similarities with your model, the Community Connect model, and the Scotland Yard model, or focus tables as they're known in Canada, formerly situation tables. Do you want to speak to any of the inspirations for how that multidisciplinary model was developed?
Oh, absolutely. And my inspirations are being talked about right here. So we certainly did talk to folks in Canada about the hub model. Chelsea, Massachusetts actually has also learned from Canada about that and has implemented a model locally, but it's not focused on, it hasn't really sought relevance for this issue of terrorism and targeted violence, but we observed the Chelsea model and learned from them. And I think, more generally, multidisciplinary team models are gaining a lot of traction in the larger space of prevention of violent extremism. So I think there are international models as well that are doing this from outside of North America, I should say. Canada is still international. So yes, we didn't make it up, but we were inspired by some of the great work that's going around the world in that area.
All right, thank you for that. I just wanted to tie it back in with the ongoing chat. Our final speaker today is Claire Abrams. Claire is with the Citizens Crime Commission of New York. And this is a model that is ongoing and really taking some of the lessons learned from early approaches and applying them with a new twist and with a focus on not just early intervention, but diversion as well. So Claire, over to you.
Thanks, Brett. And thanks for everyone for being here today. And thank you for having me to talk. So I have my stopwatch on, so I will try really hard not to run over. So as Brett said, I work with the Citizens Crime Commission of New York City. We are a non-government, non-profit, and we are tasked with intervening in the most vexatious forms of violence and stopping violence before it starts. What that has meant for us traditionally is working in the gun and gang space, specifically with youth gun violence initiatives. How DEEP came to be and how we got involved in the terrorism prevention space was actually through the Eastern District of New York, the Department of Justice. With the rise of ISIS in 2014, the Eastern District of New York and the DOJ more generally were seeing a lot of rise in cases pertaining to internationally inspired terrorism and violent extremism. But what they were seeing with these cases is that they were non-traditional versus the cases they were seeing previously with more of the kind of Al-Qaeda type cases that were coming through the EDNY. And by non-traditional, I mean they were seeing a lot of juveniles, a lot of individuals with mental health issues, individuals who weren't really ideologically committed. And they started to realize that they didn't have enough, tools in the toolbox to deal with these cases. There was effectively the option of arrest an individual or close the case and do nothing. And what they were worried about is that in the first instance of arrest, these people didn't actually really warrant a full terrorism arrest, which comes with, a heavy sentence and everything else. And in the latter case of do nothing, they were worried that these were the kind of individuals who would appear later down the line, having mobilized and being more of an imminent serious threat. So they realized that they needed, some kind of middle ground and started thinking about DEEP, which was how does one get involved in the early stages of an individual mobilizing towards violent extremism or terrorism or whatever it may be, intervene in a useful way that is going to help, not hinder, and get that individual the help that they need. So just to give it a bit more flavor, there was a couple of cases that they saw come through EDNY at the beginning, which really cemented the need for a DEEP-like program. So there was one individual online who was saying a lot of scary stuff about supporting ISIS and wanting to do something and making, borderline conspiratorial comments. And when the FBI went to do a knock and talk, they were faced with a young kid on the autism spectrum, wasn't making eye contact. The mother was in complete shock, couldn't believe how her son could be saying or doing these types of things. And when the agents really dug into the situation, there was a lot of underlying issues at play, and this kid was not ideologically committed and was not any serious threat, but did need, some intervention and help. And it was cases like that kind of got the DEEP program, off the ground, or at least the idea of the DEEP program off the ground. So we, as the Crime Commission, took over kind of developing the program to where it is today. And we spent about a year working with a clinical psychologist, subject matter experts. We've spoken to a lot of people actually on this Zoom about their expertise, including Heidi and Humera and others, when we developed our program. And we really tried to understand the population. And by the population in this specific setting, I mean individuals who are driven by something other than true ideological commitment. So we've been seeing individuals who have a lot of history of trauma. There's been a lot of mental health issues. We've seen a lot of, it's been a lot of like young people who are dealing with issues and have fallen into this kind of, not sound cliche in this CVE, PVE space, but, this belonging trap where these groups have offered them something that they're not otherwise getting. We've seen like young kids who've been bullied and they've kind of gone down this road. So when we built out the program, we kind of factored all of these things into it, the underlying behaviors and the corresponding mechanisms of behavior change. So we developed the program, and how the program looks today is basically we get a referral from traditionally law enforcement, but we have actually just started getting referrals through word of mouth from non-law non-law enforcement sources, so just community members. And the eventual goal of the program is to get referrals from communities. So we get a referral, it's completely voluntary. The individual or the guardian, the parental guardian, has to sign a bunch of consents to work with us. And we explain that we do, work with law enforcement in the sense that we get referrals from them, and we may update them in terms of if somebody's doing well and progressing, but we don't do any, reporting back to law enforcement. I think it's really important for these kinds of programs to work, as has been touched upon in previous talks, that there's a genuine level of trust. So none of these programs will work if we are just here to aid an investigation or whatever it may be. We do a lot of risk assessments, including, risk for suicide. We have taken a look at the Vera2R tool, and so on and so forth. And then we develop an individualized service plan based on what that person needs. Our model looks at a few key things, including, how to deal with some of the things that we've seen come up in a lot of cases, like isolation, black and white thinking. So how do we work with individuals to increase critical thinking? And the reason we look at that is because our program works to demobilize individuals, not de-radicalize. We don't tell anyone what they are allowed to believe or not believe. That's unconstitutional. But what we do want to do is work with individuals to see what is driving the desire for violence and why that is. So the thing around critical thinking is to kind of open thinking, challenge ideology in a way that's not dealing specifically with the ideology, but more with thinking, broader thinking in general. We work with behavioral intervention specialists who are usually mental health professionals, usually LCSWs or something similar. They're trained in the DEEP model. They work with the individual and develop the specialized plan with them and implement that plan. We also then have a wraparound aspect of community-based resources depending on what the individual needs. So we've seen issues with housing and homelessness, with individuals, although now it's difficult with COVID, with individuals who are isolated, trying to find them community resources that gets them involved in a community other than the, usually online community of the violent extremist group of choice. And the reason why the community aspect is really important is because once the individual graduates through the DEEP program, they then have those community resources to work with and to be a part of throughout their lives. We would hate to work with an individual and then, leave them to their own devices and issues come up years later and they have no external support. So we're trying to create a wraparound support system. I am just checking the time. To transition somebody out of the program, the way the model is developed is we have the behavioral intervention specialist who does the bulk of the therapy, and then a transitional specialist who helps them take what they learned in the therapy and apply it to their everyday lives as they transition out of the program. In terms of internationally versus domestically inspired terrorism and violent extremism, we've really seen both. This program was, as I said, initially thought about because of the threat of ISIS, but we've seen both. And interestingly, what we've seen with a lot of our cases is a flip-flopping across ideologies between domestic and international, which really does speak to the idea that the cases that we are aiming to work with are individuals who aren't actually truly ideologically inspired and don't even necessarily fully understand the ideology, but there's actually an underlying issue going on, and that's why this behavior is manifesting. So yeah, I'm trying to think, recently, have we seen one versus the other? Not really, it has been both, although we've actually just got kind of actually a socialist extremism case that was just referred to us, which was interesting. That's the first one of that kind that we just got. but yeah, it's kind of run the ideological spectrum, and our model doesn't have to change depending on which ideology an individual is finding appealing. The model is dealing with the underlying drivers rather than the specific ideology, so that's why it's quite useful in that regard. I do see I'm at 10 minutes, so I will stop and wait for questions, but thank you so much for allowing me to talk, and thanks, Brett, for organizing.
Thank you, Claire, for that. So audience, please, if you don't mind, turn your cameras on, join the discussion. We've only got 28 people on the line right now, so we can genuinely hear from you directly and hear your questions. So if you have questions, please, by all means, jump in, either by chat or by unmuting yourself, and I will keep an eye out for that and calling you. So one of the things that came up in the chat, and that's come up a lot over the last several years, and Claire, you touched on it briefly, is how to structure support for individuals who may be neurodivergent or on the autism spectrum, and recognizing the need for resources there without, as Heidi mentioned, contributing to stigma. So does anyone want to speak to that further? And Heidi, is this something you've encountered as well?
It's certainly something I've heard come up quite a lot. And I think, again, the value of a multidisciplinary team is hopefully you have someone who has some expertise, maybe coming out of child development, can help understand when that need might be relevant and make sure then that an appropriate evaluation or referral to services can be engaged. I would say the part that I think is also important to add to that is providers for kids who are on the autism spectrum may not have much understanding or expertise around terrorism or targeted violence. And so in order to make sure that referral doesn't either feel alarming and overwhelming or that something is missed in the process, I think it's also really important to think about how do you help build capacity for providers who might be working in a space that is new to them, but certainly are bringing an expertise that is necessary. And I think, Brett, what you're doing with this workshop is a really important contribution to that effort, but also as teams that might be referring to providers, keeping that lens around how do we help raise capacity of, because we'll never train everyone to be experts, but to follow a kid or a referral with a little extra support for that provider, I think can be really helpful.
Claire, is this something you want to speak to further?
I can only really talk to our model, but the way that we develop the model is that the behavioral intervention specialist who's trained in the DEEP model works with the individual around the demobilization. And then based on whatever else that individual needs, we find those external specialists. So if we had a kid or an individual who is on the autism spectrum and needed specialized care that our behavioral intervention specialist was not well versed to provide, we would then go and find somebody who specializes in working with autistic individuals, and so the care would be provided on both sides, both with our deep trained therapist and with a community-based specialist. And then what we are doing, I would say, with our model is kind of developing a kind of training module on an understanding of the deep specific side. So working to demobilize an individual so that we can train the external specialists so that they do have a better understanding of all the other things going on with this individual when they do work with them.
Thank you for that, Claire. Kim, you mentioned reducing the stigma within the field itself. Do you want to speak to that further? And if you don't, that's all right too. All right. So other questions that we got, please chime in with questions in the chat, or again, chime in directly with questions. In the meantime, some questions that we got in advance. And one question I think we've answered in part by providing overviews of programs today, but someone asked, other than Parents for Peace or Life After Hate, who's helping Americans with preventing attitudes of hate-based violence? Not the topic of our workshop today, but certainly something that I know Heidi, Claire, many programs are addressing, including your own. So just to answer this question, there's programs out there. We featured them throughout all of our workshops. Nearly all of the programs now are ideologically agnostic and are in fact working directly to support individuals who may be motivated by hate rather than internationally inspired terrorism, although there's an element of hate there as well. So Heidi, Claire, Humera, Milo, anything you want to say specifically on that intersection? And I know Milo referenced some of that interaction between movements. And Heidi, I know you're seeing some of this in the referrals you get now. So any thoughts on that?
Yeah, maybe I can just speak to some of the complications around it, because I, as you heard, am fully in support of the idea that we need ideologically agnostic programming. So I start at that as my foundation, but it's really complicated to do that with any level of depth of expertise, because there, as you have seen from the workshops that have been put on here, there's an enormous range of ideologies that are drawing people, and they're very complicated, and they're fast moving, and they're changing so rapidly that I can't keep up with them. And so how then do you staff a team to be ready to understand what's going on with an individual who might be drawn towards any one of those ideologies? So that is one of the complications that we are, puzzling over. I don't think we've solved it. We're approaching it through partnership. So for instance, we have in our DHS grant a partnership with Parents for Peace, because they have some range of expertise that we don't, and hopefully then we can flexibly pull in experts as needed, as opposed to staffing everyone on a team. But you lose something. If you're not sitting around the table together, you're not building that trust and relationships. There's sort of less depth of knowledge around any particular issue, and that raises challenges as well. So I just wanted to say I think it's complicated, even though I'm very squarely on the side of not tying a program to any particular group or ideology.
Anyone else want to speak to that question?
Yes, I will. And I think this goes back to where we are. So if we are finally at a place where the public health approach is being acknowledged, but also the public health approach is starting to be implemented in more than just work. And just, there was a long time where it was the label was there, but it wasn't really being implemented. And now we're actually starting to see some of that implementation take place. I think it's the issue is how much crossover is there, and is the structure of programs, can they deal with it? What can they address? And certainly for the secondary and tertiary prevention, when we're talking about it, that's a place where issues of ideology even come into play. And for example, you take like DEEP and you take Heidi's program, those are places where interventions are being done, but not touching on the ideological portion until, or like Heidi is they're bringing in the experts. But one of the differences that we have noted, and huge difference, is that in terms of primary prevention. And in the primary prevention space, there was a lot of programs for internationally inspired terrorism, and at least there was claims on that. There was a lot of programming which was happening, but there is very little truly primary preventative programming which is happening in dealing with domestic terrorism and targeted violence. and what is the, it just doesn't exist. There's very little of it. And the question is, most of those programs you cannot just take and put and say, oh, now we're going to run those, right? Because the baseline assumptions of those don't work. And so even when the words were being used, we're doing primary prevention, but we're talking about international terrorism. Reality is that the way that the at-risk or the vulnerable community was being identified had an element of profiling in it, because it was still aimed at certain groups. And now so it was, the language was, this is, we're doing public health approach, primary prevention, but reality, it was like a sugar coating or a whitewashing of the same old profile approach. Now, if you have a situation where you have, what happens if your vulnerable population is from the majority population, and you suddenly cannot in any way figure out what's the vulnerable group, except through looking at risk factors and behavioral indicators. And now we're at a place when we're talking about domestic terrorism, targeted violence, you have to truly deal. If you're going to do primary prevention, you have to really wholesale bring in the public health approach. Only way of doing it without actually dealing with issues of freedom of speech, expression, what is monitored, criminal, all of those pieces, right? Because the legal system is slightly different in who is affiliated and who can be investigated, or what level, at what point can you even start to be worried about a person, right? So, I mean, that's the reality. So that's a huge shift, because our assumptions, so many of the assumptions which underpin what's being done in North America, just no longer hold true. And I use this example, you've heard me say it often, right? How many of us are going to say we need to have a public, a town hall when we're talking to the sovereign citizens? Really? You think any of them is going to show up for a town hall with the FBI? Right? Not happening. And yet this was a prevention program which was touted for how many years, right? Let's have a town hall with the Muslim community at a mosque, and suddenly they will magically be pro whatever country they're from, right? That was, if you think about the types of programming, right? And you put that in any other situation, and it's like, what, right? How many programming, how much of like preventative programming, once we ever get to it, will actually be done out of churches? Right? Can we politically say that we should be running certain types of programming for QAnon? If you, for example, if you want to deal with QAnon and you wanted to stop people from joining, would you really talk to the evangelical churches? Because their own data from the research which is coming out is that about 50% of adherents in some of the denominations believe in QAnon conspiracy theories. And we know this because we're talking to pastors who are asking us, can you please design programs to help us? Because our congregations are falling apart and our clergy don't know what to do. Right? So there's a place where there is a disconnect. So the question is, which programs can cross over? Well, we should be careful in what we decide should cross over, and make sure that what we are designing is fit for purpose. Milo has a question.
So Milo has a question, and Milo, I will take moderator's prerogative to introduce another question as you respond, because it's right in line with what Humera was just saying. One of the questions is, how important are culturally competent subject matter experts to prevention efforts? So how important is cultural competency? And in some ways that is only one element of fit to purpose, as Humera was suggesting, but certainly an element. Milo, please.
That's great, thank you. And I was actually coming in to sort of follow up from Humera's comments and really wanting to emphasize exactly that point about, you know, it's really important to have ideologically agnostic approaches, but the fact is that approaches were built and geared towards a very specific type of challenge that doesn't necessarily represent the threat that we face today. And I think that we have to be cognizant of retrofitting some of the kind of systems that were built to deal with this sort of international terrorist threat with a capital I and a capital T, which represents a part of the picture here, but by no means the predominant part of the picture, and certainly, you know, not as a sort of clean standalone category that is distinct from the other challenges that we're seeing, we've heard reference. And I think it really points to this broader challenge we're seeing of the sort of mainstreaming of many of these extremist perspectives, and, you know, not dealing with an issue that is merely at the fringes, but rather, you know, increasingly in the mainstream, and what that means for how we respond effectively. And there are going to be really sort of tough conversations about what those institutions are, as Humera was saying, that are credible messengers, the ones that are able to provide, you know, sort of robust leadership, and recognizing there are some things that we want to sort of have as an agnostic toolkit, and other things that we want to learn the lessons of where this hasn't worked previously, and we want to sort of actually move on and sort of develop and upscale our sort of general approaches to building out these systems. I think you know, we've talked about the public health approach, but what the challenges that we're seeing more and more, and this is moving a bit beyond the sort of international terrorism focus of this discussion, is moving from the kind of needle in a haystack approach towards something that's much more broad-based and about sort of engagement in a real sense, in the way that Heidi laid out with her model, and thinking about what that means proportionately, because of course, you know, we need to understand exactly what a sort of proportionate prevention approach looks like, and where those lines are drawn. So I did really want to sort of build on exactly what Humera was saying, to say that we need to be asking quite sort of deep questions around what ideologically agnostic means, like in a context where the threat has changed rapidly and dramatically. And it's, I think one of the key trends is its ambiguity. It's becoming harder and harder to sort of categorize what threats and trends are, and we're seeing much more of a sort of difficult, sort of intangible challenge. And in the UK, this threat has been described as a sort of mixed, unclear, and unstable threat, which is now increasingly becoming a huge portion of the referrals that are received through the UK's prevent strategy. So quite a notable trend internationally as well. With regards to your question, Brett, about subject matter expertise, I think it is still a really important facet of how we think about these interventions and these prevention approaches. We still need to be understanding the specific narratives that extremists are propagating. We need to recognize the vulnerabilities that they might be exploiting. And it's really important to understand that there are many, many similarities between how extremists across the ideological spectrum operate. And there are different elements of ideological conviction. So there are some people that will be very motivated by a belief system, and others that will merely be a sort of a wrapper for a set of highly personalized grievances and issues. But that we still do need to be understanding the specific challenges and how they manifest, and you know, that real expertise is going to be an important part of the equation, but by no means the be all and end all. I think understanding extremist mobilization is never going to be the silver bullet to solve this, but it's always going to be an important part of the discussion, and integrated into this sort of multidisciplinary approach. So I'm interested to hear what other people think, but I think with the agnostic element, I don't think we should lose sight of kind of understanding the sort of specificities of specific challenges, whether that's QAnon radicalization, whether that's the specific sort of misogynistic narratives associated with incel movements, that we need to be understanding in context when thinking about individual cases.
Heidi, I know that cultural competency was something that you prioritized in your approach. Do you want to speak to the importance of cultural competency in doing this work?
Yeah, I do. So thanks for the question. I mean, I think the mental health field is getting better at understanding that if you don't have culturally responsive services, you don't have anything of value to offer to who you're working with. And when we think about what goes into culturally responsive services, I think there's both the what and the how. And so there's two kind of schools of thought, both of which are important. One is around cultural competency, and that's knowing things about a culture. And that might be, translate to subject matter expertise here. So, you know, all the read aheads that you guys do for these workshops, it's important as providers that we know some things about ideologies. It's also important that we know some things about cultures and where people are coming from. But the second part of it is more of the process. And there's this concept of cultural humility, which is taking a stance of humility in understanding that that I'll never fully understand where you are coming from, no matter how much I read ahead I will never fully understand what that experience is. And the metaphor that I think is most helpful here is like, if my culture is that I wear blue glasses and your culture is that you wear red glasses, if I take your glasses and put them on, the best I can ever do is purple, right? So you can never fully understand where someone is coming from. So these are concepts that come out of working cross-culturally. And I think it's interesting to think about, you know, how does this then play out when we're talking about ideology, which is not culture, but is related to beliefs and practices sometimes. And so what translates there? And I just wanted to reflect on a case that we had that I think shows why it's so important to have cultural expertise and in the team's thinking. So we had a referral of an individual who was actually inpatient at that time, and the providers were having a really hard time sorting out. There were some bizarre, what they saw as bizarre behaviors, and they were kind of diagnosing these behaviors as potentially psychotic. And when we brought in a religious expert, that he was actually able to help identify how, you know, certain things like the foot that you need to use to walk into the bathroom came out of a body of knowledge and an interpretation of religion. And so there is this sort of sorting out of delusions and cultural practice, and then a third component, which was sort of a misunderstanding and misreading of religion and a more kind of extremist ideology that was also playing a role. And so it was sort of like there were these three components of mental health, culture, and ideology that all needed to be understood and could only really be sorted out by having people who had those expertises around the table. So I'll stop there, but I think it's hugely important to think about cultural responsivity as we build these programs.
Claire, do you want to speak to the importance of cultural competency at all?
Yeah, it's obviously, as everyone said, highly important. And we when we've been going through our hiring process, I was just checking, I was actually unmuted. When we were going through our hiring process, we have actually been trying to factor that in. And we also, you know, when we were developing the model, we took this all into consideration. We actually did a few sessions with ISD around cultural competency and understanding the various factors to consider. I also think it's pretty important because cultural competency and kind of understanding the various ideologies allow you to understand what an individual is actually getting from that ideological group or that cultural group that they're associating with, whether it be positive or negative. So that allows you to, in the work, think about what that individual might be needing and might need to get elsewhere. And then the other thing is, I guess, cultural competency and ideological competency, all really important. But the other thing is, and Milo actually touched upon this, is some individuals just have genuine grievances. And I think it's really important for all of these programs to keep that in mind. It's not that everybody who is adhering to these different ideologies or groups, you know, is, you know, crazy or whatever it may be, but, you know, there are genuine grievances here, sometimes founded, sometimes unfounded, but as long as the individual thinks that the grievances are founded, that's all that really matters. And I think working with individuals, it's important. I know this is off the cultural competency thing. Working with individuals, it's important not to just disregard those grievances as ridiculous, but to actually understand that they are there and they're there for a reason, and to work through why the grievances may be valid, but definitely don't allow to justify the use of violence, you know, in having those grievances. So I went off a bit of a tangent on that one, but yes, cultural competency, very important. And that's all, thanks.
That's all right, Claire, you gave us a bit of a commercial for our next workshop, which will focus on promising practices as practitioners for addressing mis and disinformation, which can sometimes be fueling those grievances. Jim, I see you've got a hand up. Please jump in.
Thanks, Brett. No, I just want to just weigh in about one thing regarding the culturally responsive services and cultural competence and cultural humility. And I guess I was trying to figure out initially why, and I don't remember who coined the term during this talk, sort of a agnostic agency. I don't remember who used that term first, but with cultural competence and culturally kind of sensitive services, and I think an organization can set itself out as kind of taking an agnostic stand, but agencies are staffed by people who have their own implicit biases, regardless of the agency's overall stance. So I just wanted to just put out there the issue that I think cultural competence and culturally sensitive services are one piece of the equation, but the other piece of the equation is the staff that work in these organizations or work in these spaces also need to become critically self-aware of the biases they're bringing into their interactions. And you know, I guess I was trying to figure out why I was bristling about the term agnostic, and I can see it from a aspirational systems level, but I think it's a bit unrealistic at the staffing level because of the kinds of biases people bring to the work they do, regardless of the organizational structure they're trying to operate in. So to me, the internal biases is a piece of understanding why culturally competent services are so necessary, but also sometimes complicated.
Jim, thank you for that. I think that word might have come from me. So I apologize for my imprecision here. I was trying to get at agencies that take referrals across the ideological spectrum. And Kim has made a good point in the chat that there are also individuals who may be motivated to targeted violence, and that motivation isn't coming from ideology. And recognizing, as Kim has so eloquently put in the chat, we need to see individuals as individuals and not purely as any dynamic that may be happening with them, whether mental health or otherwise, recognizing the whole individual. All right. Humera, you wanted to promote a program. Do you want to jump in and do that now?
Sure, thank you. So this is going back to, we talked about prevention and actually prevention across the ideological space, especially for domestic terrorism and targeted violence. So, you know, as I mentioned, there aren't very many programs or actually like real programs on the primary prevention. So after raising that issue for several years, we are actually in the process of developing one. And actually, we do have DHS funding for this. It's one of the innovation grants. And I think this is where we also have to be shifting, right, organizationally, because when we were dealing with anything which touched on the internationally inspired and given the reality of the US and the trust in the communities, we did not take any government funding for any, we still don't. We don't take any government funding which touches or can potentially touch the Muslim community. But when we're talking about a larger broad-based thing, we have, for example, we actually do have the DHS grants. So this is what we're building out is a community resilience early warning system, CRUISE, lovingly called CRUISE. And the idea is actually looking at the risk factors and understanding for any geography at the county level, what are based on risk factors which have been identified through these decades of research for extreme right wing and also targeted violence, is seeing what is the incidence of any of those factors, the occurrence of those factors, and trying to figure out, again, using machine learning, is there actually a relationship And that's something which is actually not being done, because we have a whole lot of research which talks about, well, we think that these are the risk factors. And then there is research which talks about how individual risk factors might be statistically significant. But there's very little which is on what happens when you combine them, what happens when you have multiple risk factors, what happens when you have protective factors at play, how does it actually play out? And it's really trying to understand, okay, let's use data and figure out, is there a gap or a difference in a particular geography versus a geography, for example, where we know perpetrators have come from? Is there anything which is happening at the environmental level, the society and community level, not at an individual level, which can actually like literally reduce vulnerability? And internationally, in fact, if you look at programming and you look at programming dollars, billions of dollars have been spent across multiple governments on actually building out, on really focusing on the social and the community level risk factors, right? How do we change those dynamics? But it's not being done domestically. Right? Domestically, the focus has always been on individuals and individual level factors. Who is the one person? And law enforcement is all about finding the one person and not looking at, hey, is there a greater risk which is coming from the environment that you're living in? And so this is an attempt to figure out, can we actually see that? Can we see what is possible? But then working with the local governments to develop local prevention programs. So working at the municipal level to say, okay, well, here's a gap. We're seeing that in your place, maybe it's going to be on the education sector. Maybe it's on social services. Maybe it's on veterans affairs and the services they're providing. And seeing that, hey, is there something that you can actually really build out your protective factors at the county level? So we have a few pilot locations who are willing to try it out and test it out to see if there's ways of, one, mitigating risk factors and really building out protective factors based on what data says is where they might have a gap. So that's cruise. And hopefully by the end of next year, when our funding is done, we will have working models and you'll be hearing about us reporting what worked and what really didn't work. And frankly speaking, what the data supports, if anything, in terms of all this research which has been done on, hey, here are all these risk factors and maybe they matter, and frankly speaking, maybe they just don't.
Other questions from the audience? We've had a lot of discussion, some of it in the chat. Our last two workshops, we had a workshop on white supremacists and anti-government threat. We had a workshop on involuntary celibate and misogynistic violence. This workshop is on internationally inspired terrorism, but as Milo referenced and other speakers have flirted with as well, these aren't neat boxes. And this is something that's come up in the chat. How, as a provider, are you approaching individuals and as individuals and recognizing that these lines are blurred across the ideological movement? Heidi, Claire, Mara.
I was just going to say that between Milo, Heidi, Claire, and myself, we've left them speechless.
I mean, I could just speak for our program. I mean, the way we think about it when we get a referral is we want to understand the whole of this kid. And I say kid because we are 18 and under in our program, but we are doing a thorough psychosocial assessment, trying to understand across the social ecology, strengths, risk factors, family life, what is this kid drawn towards and why? And that's not just about ideology, that's about like clubs or hobbies. And so I'm based at a children's hospital. I'm a clinical child psychologist. I think of individuals we're working with as developing kids. I think part of that is understanding the pull that they might feel towards certain ways of being or thinking, belonging. I think Claire talked about belonging before, but it's really central. And so that's often, how we see these more extremist groups coming into play is in kind of asking the question, what's in it for them? What are they getting out of it? And are there other places that they could be finding what it is that they need? And can we help to facilitate those connections? And our focus is much more about those other connections and building what's missing as opposed to taking down what's there. That we'll see how it plays out. But the way I think about it is that the value of maybe what's in place right now will diminish if other things are stepping in to fill some of those fundamental human needs that individuals are experiencing.
Anyone else want to speak to that? Speaking individuals as individuals with all of the blurred lines we see. All right, any other questions? I think this is our quietest audience to date. Okay, well, we will go ahead and Addie, if you want to start the post-workshop poll. As I mentioned at the start of this workshop, we are asking everyone to participate in the survey if you haven't done so already. We're building a multidisciplinary network of professionals addressing targeted violence, terrorism, and their impacts across the United States. We're particularly interested in including mental and behavioral health practitioners in this network, and building capacity and confidence among mental and behavioral health practitioners to accept these referrals. I want to thank our speakers for very candid discussion today. It's a difficult topic, and as Humera and Heidi mentioned, there's a lot of history here that hasn't all been positive and has created a lot of distrust within Muslim communities in particular, but really communities across the spectrum as well. And how do we as practitioners work to rebuild that trust and build programs that can serve individuals as individuals, recognizing all of their strengths as well as risks and needs. So thank you for your comments. Thank you for sharing your models. Thank you to some of our international participants for flagging the ways that models developed here in the United States have drawn inspiration from models overseas, especially in Scotland and Canada. And so I want to thank the audience for participating in this conversation. This isn't honestly, nothing we've tackled in this network is settled in stone, and here are the best practices that we can deliver from on high. This is a network we're building to have conversations among members to better understand these challenges and what promising practices we can use to address them together. But it's very much an iterative process. We hope you will join us for our next workshop. That is 2 weeks from today on September 28th, where we'll be discussing the role of mis, dis, and malinformation in targeted violence and promising practices for approaching clients who have been consuming this information. I've actually asked Heidi, one of our speakers today, to help us in structuring that workshop, bringing in clinical professionals to give their take, not necessarily individuals who spend all day working on targeted violence and terrorism, but who are in the trenches doing clinical work and understanding promising practices from a variety of clinical disciplines, psychologists, psychiatrists, social workers, and others, in thinking through as a community, how do we effectively address misdis and malinformation when it appears in a clinical setting? As I mentioned at the beginning of the workshop, please reach out to Addie if you have suggestions for future workshops, if you have suggestions for topics that we should address at our more network-based workshop that we're putting on this fall. We welcome all of your suggestions and your feedback on these workshops to date. As we launch this network, we're going to start to convene committees. We expect the first convening of those network committees to occur at that fall symposium. And so please fill out the seminar, fill out the survey, and let us know if you want to join any of the committees. We want this to be as inclusive a process as possible. We are hard at work to create that virtual symposium and welcome your ideas of how we can structure that symposium to best facilitate dialogue and exchange among the network. As I've mentioned already, this is going to be much more robust than the 2-hour workshops that have largely been one way to date. We want to facilitate more conversation in that fall workshop. So stay tuned and let us know if you have ideas on how to best do that. Thank you again for joining us today, and we hope to see you on September 28th for our workshop on misdis and malinformation. Thank you again to Milo, Humera, Heidi, and Claire for sharing your expertise today. We appreciate you.